I have a study, and I need to know how many patients I need. I think I only need 3 patients.
Okay, what kind of study is it?
I'm doing a lab study. Can I just use 3 patients?
That depends. What are you trying to show?
We always use 3 patients.
Okay, what are you trying to show?
I'm trying to show that drug A and drug B are better than only drug A.
How are you measuring if it is better?
We are looking at apoptosis. Can we just use 3 patients?
What kind of measure of apoptosis? Do you know how variable that measure is?
We always use 3 patients. That is what we have published before.
3 patients per group or in total?
Yes.
Okay, let's try something different. What type of measure are you using? And is this an in vitro study? An in vivo mouse study?
It is an in vitro study of patient samples, and we are looking at measures of apoptosis after treatment with drug A and drug B versus drug A and control, and drug B alone.
Oh, how many groups are you analyzing altogether then?
My grant is due tomorrow. I just need to know if I can just use 3 patients per group.
Okay, well, you probably should have come to me earlier for help with this.
All I need you to do is tell me that 3 patients are okay.
So, it is not that easy. Your marker for apoptosis may have a large amount of variability associated with it that could make it difficult to ascertain differences based only on 3 patients per group. It also depends on what kind of outcomes you are looking at. Are you looking at normalized changes in expression levels from baseline? 3 patients may not be sufficient to detect differences in these expression levels between the different treatment groups.
I do not understand.
I'm saying that you may need more than 3 patients per group, but that I need more information to determine that.
The serine protease granzyme B is made in cytotoxic lymphocytes, where it is inactive due to the low pH of the storage granules. It is measured immediately upon delivery into target cell cytoplasms, where the pH is neutral. This is followed by cleavage of procaspase 3 by granzyme B in the target cell cytoplasm and the subsequent induction of apoptosis. All proteolytic events can be quantitated at the live single-cell level by flow cytometry and imaged by confocal microscopy.
I understand very little of what you just said. Maybe we should talk more about this.
I just need to know if 3 patients are enough. My grant is due tomorrow.
We will need to meet to better understand this before we can determine the appropriate sample size.
I can put you on my grant for 0.5% FTE. You can design and analyze the data later.
Do you really think that is enough to do the work?
Well, it may be less if it is awarded and the budget is cut.
Please go away.